Good afternoon. Welcome to this little video session on Organ Donation Day. I'm Dr. Sharat Putta. I'm the Chief Hepatologist at KIMS Hospital, Secunderabad. I have with me Dr. Ravichand Siddachari, who is the Chief Liver Transplant Surgeon at KIMS. Today is the 13th of August is celebrated as an Organ Donation Day to increase awareness about organ donation. Now, organ donation started for the first time way back in the 1950s when a twin brother donated his kidney to his identical twin brother. Dr. Joseph Murray, who performed the operation, subsequently went on to win the Nobel Prize for Physiology. So, Dr. Ravi, so what is organ donation and how does it help for the sake of the general audience that may be tuning in today?
Okay, so organ donation is a life-giving process. So we can use the organs from brain dead person and also some living donor person also. This organ is used for a patient who is in need. So who are these patients who are in need of organ? Any patient suffering from chronic diseases, chronic illnesses, and sometimes even acute illnesses where it affects an organ and that organ fails to function. It cannot perform its normal function and the body cannot cope up and he may lose his life. So in that case, we have to perform a transplantation where an organ is used from either a brain dead or a relative of a person where it is called as living donor, and we use that organ to and transplant to the patient.
So you would choose to perform this very complex operations when you use the word chronic or acute, and you would do it when the organ has failed irreversibly. Is
yes.
That when you use the organ?
When the organ has failed irreversibly and there is no further medical treatment, whatever medical treatment you have tried and it is not.
Yes, so when there is very little hope that treatment can reverse or regenerate the organ,
yeah,
that is when
we use the organ. Yeah, that is right.
Okay.
Yeah,
so I mean, this has been there in Hindu mythology where Lord Vinayaka had his
exactly.
transplanted all those centuries ago. So so you can.
So, Dr. Sharat, can I ask you then who can donate and what is exactly the brain death? You said brain death. So, what exactly is brain death?
See, like you mentioned, Dr. Ravi, there's two scenarios where organs are donated. One is from a living donor, for example, a mother donating to a child who is suffering from irreversible organ failure. So we take half of the organ, or maybe even less than half, when the donation is going to a child. Sometimes even a third is enough. And we are transplanting it into a close relative. That is called living related transplantation. Living related transplantation, for example, the most commonly transplanted organs will be the kidney with living related transplantation. And there's certain organs that cannot be used for living related, like for example the heart. There's only one heart, and you can't cut it in half.
Of course, yeah.
So for living related has its role, but there is a limited role in terms of the different organs that can be used. Principally today, what we are trying to raise awareness about is what we call deceased donor.
That's right.
Organ donation, wherein the donor is deemed to be brain dead. Now, and you can ask me, what do you mean by brain dead? I mean, does that mean the person is dead? Yes, for all practical purposes, that person is dead. The brain ceases to function. There is no cortical function. There's no brain function anymore. The brain stem is dead, and the heart of that person might still be beating, and the person might still have a pulse and a blood pressure, and organs will still be functioning because the person is on artificial organ support.
Yes.
Typically, these patients are on a ventilator. They may even be requiring dialysis or blood pressure support medication or other medications to artificially support life.
Yeah.
Um,
So the moment you withdraw the support is going to.
Absolutely right.
Yeah.
So the moment we remove there is no hope that this patient will recover and come off supports. And brain death is a very, very hard endpoint. It's a diagnosis that's not to be taken lightly, and there are some
Yes.
very, very strict criteria that are used to diagnose brain death.
Yes.
And the brain death is typically where we have to demonstrate that there are no brain functions left. And this is typically done by an experienced neurologist or an experienced intensive care doctor. And the tests that are done for brain death, they are typically repeated on 2 different occasions, several hours apart.
Yes.
So there are many tests that are done in one go, and then the tests are again repeated after a few hours, and then the brain death is confirmed by 2 different experienced physicians. So once this is done, then the patient's families are typically approached. One is to declare the brain death, and then at this very somber moment, there are what we call organ donor coordinators, who are the key role players in this whole process of organ donation, where they they talk to the family and they request if the family would consider organ donation now that the patient has been declared brain dead.
Yes.
Yeah, so Dr. Ravi, we're just trying to make this interactive, so it is interesting for
Yeah.
people that are people tuning in. So, now once the patient is declared brain dead and the family agrees to a donation,
Yeah.
how do you? So you will go in and you will retrieve the organs. You
Yes.
remove the organs from the donor.
Yes.
Now, will that cause a lot of disfigurement or pain to the donor? Can they experience pain?
Yeah, that's a good question, and I think most relatives, they ask, when the worry is that I don't want my relative or my son or my whoever they don't want them to have that suffer. So that's the question that everyone asks. So, but these patients, they are brain dead and they are on support and they don't feel anything, and so that.
So pain is a brain function.
Yes.
So now the patient is brain dead. There is absolutely no chance that they'll be able
No
to
chance that he will feel anything.
Okay.
Yeah.
So all the senses are numbed.
Are numbed. Yes. Yeah.
Okay.
Yeah. And the other question which commonly people ask is that, okay, you're going to cut and take the organ, so that may cause disfigurement, because people think that, when I'm going to do my last rituals, you don't want a person's body disfigured and you're going to, either bury or burn or whatever. So what we normally do is that, we do it in a way that it is not seen outside. So the organs are harvested, whichever, like the heart, lungs, kidneys, abdomen. So the cut is through midline and it is usually not seen. The face is not disfigured, the limbs are not disfigured. So the cut is only in the middle, and that is usually covered. So we don't cause any disfigurement. So you don't have to worry about that.
Okay.
So
so once you retrieve the organs, how do you then prepare them or store them before you actually put it into the donor?
Right. So each organ has certain what we call as ischemia time. That is the time when you can store it and reuse it. So the organ starts functioning again. So the heart, lungs have a very short time, and then the liver can be kept up to 10 hours is okay. Kidneys can be kept up to 16 hours, 18 hours, and there are some machines also to keep them in a functioning status. So these organs, there is a full protocol about it, and then we use some solution to preserve these organs, and these organs are stored in the eyes. And normally when we plan the operation of a organ transplantation, so these are planned, the patient is also simultaneously brought, and we retrieve the organs and use the solution to preserve them. And then once the patient is ready for implantation, then we use these organs to put it into the patient.
Right, right. So that's very interesting. So what are all the organs that can be retrieved and used for transplantation?
Yeah, so it's really wonder that one person can donate so many organs that almost everything except brain can be used for transplantation. So namely, so you can say heart, yes, lungs, liver, both the kidneys, pancreas, intestine, so almost everything, and skin, cornea, of course, and the bones are also used. So almost every organ can be used except for the brain, which is very difficult. So one person can save at least minimum of 8 patients, sometimes 8 lives. Yeah.
So one potential donor can save 8 lives. Yeah.
So
yeah. And what do you think? What do you think are the issues surrounding organ donation? Why is it so important? Why are we sitting here today discussing about organ donation?
So we are going through a very tough time called the COVID time. So you know that lungs are failing; they're not functioning because there is requirement for oxygen, and sometimes the lungs are getting irreversibly damaged, and the only way is to change the lung. So this is only because of the COVID. Now people are coming to this awareness. But over a period of time, we know that number of patients are on dialysis, and over many years, and the patients have to go at least 2 or 3 times a week to the hospital. Their time is wasted, the money is gone, and they are unable to work and do anything. So these are about the kidneys. What about other organs such as the liver? So there are at least some 2 lakhs some plus patients suffering from liver diseases and liver failure.
Suffering from liver failure, needing
transplant.
Okay.
So if you don't transplant, they're going to die. So roughly the estimation is about 2 lakh patients in our country are dying from liver problems alone. And when it comes to kidneys and the heart, lung, and everything, roughly at about 8 to 10 lakhs maybe are dying. And it is actually more than just the COVID death we are seeing.
So there are a lot of patients who are in organ failure.
Yes.
Who require, transplantation.
Yes.
There's a lot of demand, but the donation rate is what is the mismatch that you're talking about?
So the donation is very, very low in our country, and we only started transplant in late 90s and early this century. So the act came in 1994. The government of India passed this act of organ brain death declaration. So in 94, whereas in the US and other countries, it was started in the 60, much earlier, at least 2 decades earlier.
So can somebody choose to be when they are alive? Can they take an active decision to decide to be an organ donor?
Yes, that is.
When they end up in a situation where they are brain dead.
That is important. So you can choose to be a donor when you are alive. You can say that I want to donate. There are registrations possible through the NOTO or SOTO. This is the National Organ Transplantation Data Service. You can either the phone call or the form can be. You can go to any hospital which is a transplant center. They'll give you a form. You can fill the form and give it to them. We can register that. And many advanced countries, the Western countries, what they do is when you are getting the driving license or when you are visiting in a hospital, somebody might you would like to donate your organs in case of death. So that is, so that when the person dies by chance, an accident happens, that card is there in his wallet or in his purse or this thing. So that can be seen, and so his wish is there. So he wants to run. So that is a very organized way of doing organ donation, rather than just asking, that I don't know whether he wanted to donate or not donate.
Deciding ahead of time.
Exactly.
Maybe discussing with your family members.
Yes.
About your wishes if you were to be in that unfortunate situation.
That's right.
So planning ahead of time could be a
Be
a good option. So yeah, that is what we have, a brief summary of what is organ donation and why it is so important for millions of people waiting across the world with organ failure that would require transplantation. And we could pledge ahead of time to become organ donors. I know this is not an easy subject for most of us, and discussing death or brain death is it's a very sensitive topic for most of us. So we all understand that, but hopefully all of us should push together in increasing awareness about organ donation and the huge need, the huge void there is that exists at the current point in time. So this is Dr. Sharat and Dr. Ravi signing off. Thank you for tuning in.